Hi, welcome to Professional Certifications channel. Let's break down NCLEX exam preparation, one topic a day for focused and effective learning. Today's topic is osteoporosis.
What is osteoporosis? First, what exactly is osteoporosis? Osteoporosis is a condition where bones become weak and brittle, making them more prone to fractures. It occurs when the creation of new bone doesn't keep up with the removal of old bone, leading to a decrease in bone density. Osteoporosis is often called a silent disease because it progresses without symptoms until a fracture occurs. Common fracture sites include the hip, spine, and wrist, which can significantly impact a person's quality of life.
Causes and risk factors. Now, let's talk about what causes osteoporosis and who's at risk. Osteoporosis results from an imbalance between bone resorption, breakdown, and bone formation. Key risk factors include age. Bone density peaks in the mid-20s and declines with age. Gender. Women, especially postmenopausal, are at higher risk due to decreased estrogen levels. Family history. A family history of osteoporosis or fractures increases risk. Low calcium and vitamin D intake, essential for bone health. Sedentary lifestyle. Lack of weight-bearing exercise weakens bones. Smoking and excessive alcohol, both impair bone formation. Medications. Long-term use of corticosteroids or anticonvulsants. Chronic conditions, such as rheumatoid arthritis, hyperthyroidism, or celiac disease. Understanding these risk factors is crucial because many of them can be managed through lifestyle changes and preventive measures.
Signs and symptoms. Recognizing the signs and symptoms of osteoporosis is vital for early intervention. The most common symptoms include back pain, caused by fractured or collapsed vertebrae. Loss of height, over time due to spinal compression fractures. Stooped posture, also known as kyphosis or a dowager's hump. Fractures, occurring with minimal trauma or even spontaneously. Fractures, especially hip fractures, can lead to significant disability, loss of independence, and even increased mortality in older adults.
Diagnosis. So, how is osteoporosis diagnosed? It starts with a thorough assessment, including a detailed history and physical exam. Key diagnostic tools include 1. Dual Energy X-ray Absorptiometry, DEXA, scan, measures bone mineral density, BMD, and is the gold standard for diagnosis. 2. FRAX tool, assesses the 10-year probability of fracture. 3. Blood tests, to check calcium, vitamin D, and other markers of bone health. 4. X-rays, to detect fractures or bone loss.
Treatment. Treatment for osteoporosis focuses on slowing bone loss, increasing bone density, and preventing fractures. Here's what you need to know. Medications. Bisphosphonates, such as alendronate or risedronate to slow bone loss. Hormone therapy, estrogen or selective estrogen receptor modulators, SERMs, for postmenopausal women. Denosumab, an injectable medication that reduces bone resorption. Teriparatide, a synthetic parathyroid hormone to stimulate bone formation. Calcium and vitamin D supplements, essential for bone health. Lifestyle changes. Weight-bearing exercise, such as walking, jogging, or strength training. Balanced diet, rich in calcium and vitamin D, e.g., dairy, leafy greens, fortified foods.
Fall prevention, remove tripping hazards, improve lighting, and use assistive devices if needed.
Smoking cessation and limiting alcohol, to improve bone health.
Nursing care. As nurses, our role is critical in managing osteoporosis patients. Here's what you need to do. 1. Educate patients, teach them about their medications, the importance of calcium and vitamin D, and fall prevention strategies. 2. Encourage exercise, promote weight-bearing and muscle-strengthening activities. 3. Monitor for fractures, assess for signs of new fractures, especially in the spine or hips. 4. Support adherence. Ensure patients take their medications as prescribed and attend follow-up appointments. 5. Emotional support. Osteoporosis can be overwhelming. Provide reassurance and address their concerns.
Conclusion. To wrap up, osteoporosis is a common but manageable condition that requires careful management. By understanding the causes, symptoms, and treatments, you can make a huge difference in patient outcomes.